Hello, my friends. It's Dr. Sharon with Clinic Reviews. Today, we're talking about post-mortem care. Whenever I do NCLEX questions from random question databases, I always get a post-mortem care question, and I'm always like, oh, I can't remember. What am I supposed to do? So I want to make sure that you know those. I want to make sure that I know those. So let's go ahead and get started. Hello, Clinic Review family. How are you doing? I hope you're having a great day. I'm starting back at work, so I'm running a little bit late today since my summer is essentially over and I'm back working. I suppose all of you are probably working hard too. Today, we're going to be talking about postmortem care. See, it's pretty fundamental. If you look in your fundamentals textbook, you're going to find postmortem care. So it's not super complicated, but there are some things you need to remember. We're doing the Blue Book. The Blue Book is the Blue Book. That's the name of the book. You can get it on Amazon. You can get the app at clinicreviews.com and purchase the Blue Book app. This is I think it's page 87 or 88. So, again, it's not super complicated. I'm part of the bigger Clinic Review organization. We're all part of the Clinic Review family. I'm part of the bigger Clinic Review organization. We do NCLEX reviews. The GOAT, Mark Klimek himself, does those reviews, and you can also do small group tutoring. I help with that. You can also do streaming services. If you're getting ready to take your NCLEX really soon and you want to watch all of our videos kind of without any commercials or mess around with that, you may want to do our streaming service. All the videos that are on YouTube plus some others are available for about $19.99 a month at the streaming service. You can watch them all without any commercials. You can get through a lot of them pretty quickly. So that's something you may want to consider doing. All right, let's go ahead and get started. I teach the Blue Book by doing questions, and there's not really much to teach about postmortem care. Either you know it or you don't. So let's go ahead and get started. In the event of a suspicious death, what is the priority action for the nurse regarding tubes and drains? All right, what's the key word here? Suspicious death. They could have said that they're going to have an autopsy. Only suspicious deaths have autopsies. So they can say either it's a suspicious death or they can say they're scheduled to have an autopsy. Both of those things would mean the same thing, okay? So remove all tubes and drains immediately after death. Leave all tubes and drains in place until the medical examiner arrives. Flush all drains before removing them. Cut and discard tubes, but leave the sites open. Y'all, you have to leave everything in. If it's a suspicious death or they're going to have an autopsy, you have to leave everything in. Don't remove any of the tubes and drains. And it's important that you document the state of the body, how it was. The medical examiner is going to have to look at the body. The medical examiner will remove the tubes and drains, or they'll tell you to remove them if they're not going to remove them. But you don't do anything. Really, you don't do much with the body. You can use a sheet to cover them up if the family wants to come in and see them. You can use a sheet to cover some of those things up, but you don't do much with the body. While performing postmortem care, the nurse attempts to close the patient's eyes, but notices they are not staying shut. What is the most appropriate action? Apply gentle pressure to keep the eyes closed. Use a moist cotton ball to close the eyes. Notify the physician immediately. Tape the eyelids shut. So it is appropriate to close the eyes and the mouth. And if the mouth won't stay shut, you can prop it shut maybe, or use something to hold it shut if you want to. You don't have to, but like if the family's coming in to visit, they don't want the eyes open, y'all. This is not a suspicious death. It's going to tell you they're scheduled for an autopsy or it's suspicious death. Otherwise, assume it's not a suspicious death. They're going to have to tell you if it is. And so if you're doing postmortem care and you're assuming that somebody's going to see them, the family's not going to want the eyes open. So go ahead and close the eyes. You don't have to use anything special. And it's not saying the eyes won't close. It's saying they won't stay closed. So it is appropriate to use a small piece of tape to keep those eyelids closed if you need to. You can use some kind of a tie if you need to keep the chin up, to keep the mouth closed. If you think it would be distressing for the family to see that, try to hide those things, but you want to try to make the body as attractive as you can for the family to come in to see that body. Oh, tape the eyelids shut is the correct answer. The nurse is preparing a body for viewing by the family after death. Which of the following should the nurse do? Place a pillow under the patient's head to prevent facial discoloration. Position the body flat on the bed without a pillow. Leave the patient's eyes and mouth open. Cover the body completely, including the face. Well, we know we're not going to cover the body completely, including the face, because the family's coming in to see them, and we don't want to leave their eyes and mouth open. So how do we want to position the patient? Do we want to keep the head up a little bit, or do we want to keep it flat? We want to keep the head up a little bit. I know you've heard of the word rigor, R-I-G-O-R, rigor mortis. Rigor mortis is when the body becomes hard and you can no longer really bend arms or do anything. That takes, I don't know how long that takes. I'm not a medical examiner, but it takes a certain number of hours for that to happen. But there's another thing called liver mortis, L-I-V-E-R, liver mortis. And when you leave the head of the bed complete, or you leave the head completely flat, sometimes that the blood from the liver can move up into the face and can cause bruising and swelling of the face. And since the family is coming in to see them, you don't want that to happen yet. It's okay when you take them down to the morgue. It's okay for them to be laying flat. But if they're coming in for the family to see them, keep the head up with a pillow. You can keep the head of the bed up a little bit, but you don't want liver mortis to occur before the family comes in. A patient's death is expected and post-mortem care needs to be completed. The patient had a nasogastric tube in place. What is the correct action regarding the NG tube? Clamp and cut the NG tube, remove the NG tube, leave the NG tube in place, remove the NG tube and place a cotton ball in the nares. Just remove the NG tube, y'all. You don't have to place a cotton ball in the nares. I mean, if the family's coming in, put the head of the bed up a little bit so swelling and stuff doesn't come in. You can, if you pull the NG tube out and something dribbles out, you can clean that off, use a little washcloth and clean that off. But just, you got to pull everything out. Okay. The nurse is preparing to complete postmortem care. The patient had an IV line in place. What is the correct action regarding the IV line? Remove the remove it and cover with sterile dressing. Leave the IV line and fluids in place. Cap the IV line and leave the catheter in place. Inject 5,000 units of heparin in the line and then remove it. So you want, unless it's a suspicious death, you want to pull everything except the IV line. You leave the catheter in place. You don't want to leave the fluids hanging. No need for that. You don't want to pull the catheter out because things could leak out, and it has something to do with how the funeral home is going to prepare the body and what they're going to put in and all kinds of stuff. So if you remove the IV catheter, some things can leak out. I guess that's not ideal. So leave the catheter in place, cap it off. All other lines you can pull. Okay, you can pull an NG tube, you can put a Foley catheter, but leave the IV catheter in place and just cap it off. A patient has passed away unexpectedly and the death is considered suspicious. The UAP is in the room preparing the body. With which of the actions should the nurse intervene immediately? The UAP is removing the Foley catheter and IV line. The UAP is placing a name tag on the body. The UAP is gathering all client belongings and placing them in a bag. The UAP is closing the client's eyes and mouth. So they can close the client's eyes and mouth. That's not a problem. Probably wouldn't want to tape them, right? Because it's a suspicious death. I wouldn't necessarily put tape on them, but they can close the eyes and the mouth. Put all the belongings in a bag because that's going to go with them. The medical examiner may need to look at that. The police may come in if it's a suspicious death and want to look through things. So you're not handing all their belongings over to the family. You're putting them in a bag so people can examine them if they need to. And you do put a tag both on the patient and on the body bag. And it's not the ID band, okay? So the ID band is a hospital identifier. You don't leave the ID band on. There's going to be tags that are specifically used to tag the body. And usually the body bag will then have a place to document the name as well. So you want to do both, two tags before they go down to the morgue. But you don't, if it's a death, the UAP should not remove any of the lines. The UAP is completing postmortem care before the family enters the room. Which of the following instructions should the nurse provide to the UAP? So the UAP is going to provide the care. So what are we going to tell them to do? Clean the body with soap and water. So this is a typical death. This is not a suspicious death. If it was, they would tell us. And for a non-suspicious death, a routine death, clean with soap and water. That's perfectly fine. Now, a lot of hospitals have Sani wipes that they use. some kind of sandy wipes. You might go, well, we use these wipes. We don't use soap and water. Y'all use the wipes, use soap and water, whatever you want to, but cleaning the body is a part of postmortem care. They're not going to do an autopsy. They're just sending them right to the funeral home. You clean the body up for the family to see it. So you clean the body. Yes. Leave all tubes and drains in the body. No, this is a non-suspicious death. If it was a suspicious death, they would tell you that. They didn't say that. So we're not going to leave all tubes and drains in the body. Remove the IV line. No, we leave the catheter in place. We just cap it off. Keep the dentures in place. Yes. The family is coming to visit. So we're going to leave the dentures in place until we're ready to take them to the morgue. So this says prepare to complete postmortem care before the family enters the room. So we're going to take out all the lines except the IV line. We're going to clean the body. We're going to leave the dentures in place so that the patient looks to the family as normal as possible. Ask the family for the clothes they want placed on the patient. No, we do not place personal clothes on the patient. We just place a hospital gown on them, a clean hospital gown. If it needs to be a clean one, we put that on there so the family can come in. Close the eyes and the mouth. Yes, we do that. Place an incontinence pad under the patient. Yes. Could say a peri pad. I don't know, but that it's not that the patient necessarily is going to be incontinent, but just in case body fluids come out after death, we place that under the patient just in case. Draw the sheet up over the face. No, the family's coming in. We're going to get a clean sheet. We're going to get clean. We're going to clean the body. We're going to remove the tubes and drains, leave the IV catheter in place, put a clean gown, put a clean sheet, put a peri pad or incontinence pad under the patient. We're getting the body ready for the family to view. Place the patient in a supine position with the head of the bed slightly elevated. Yes, that's exactly what we want to do. So these are the things that we want to do. I would say out of all the questions that I asked you, this is probably the most important one for you to remember. This covers just about everything that you're going to need to know about normal postmortem care. When preparing to transport a deceased patient to the morgue, which positioning technique is most appropriate? Place the body in a semi-Fowler's position. Ensure the body is in a supine position with arms at the sides. Position the body on the left side to prevent discoloration. Elevate the legs to prevent pooling the blood. Y'all, the head of the bed should be up before the family comes in to visit, but once we're taking them down to the morgue, they can be prone with the arms at the side. Okay, that's perfectly acceptable for transportation to the morgue. A patient who is actively dying no longer has a palpable pulse or respirations. What should the RN do next? Document the time of death. Place a cardiac monitor to determine if the heart is still beating. Notify the healthcare provider to declare time of death. Notify the charge nurse to assess for signs of life. Okay, it's the healthcare provider that has to declare time of death. So the most appropriate thing for you to do next, you don't need to have another nurse come and check it. You're the RN, y'all. Don't go, well, I would have another nurse come and check. Look, if you would have another nurse come and check, that's fine. But on the NCLEX, you're the RN. You do not need someone else to come in and check it. You need to have the healthcare provider determine if they're alive or not and determine time of death. The healthcare provider determines time of death, not you, not me, not the charge nurse. The doctor, the healthcare provider, whoever that is, documents that. And there's no reason to put a cardiac monitor on them. If you can't palpate a pulse, you can't palpate a pulse. They're not breathing. There's no pulse, y'all. Apparently, they're dead. Okay, have the healthcare provider come in and declare it. A student nurse is working with the RN to prepare to transport a deceased body to the morgue. The student asks if the hospital gown should be removed. The best response is, so we put a clean hospital gown on the body for a family to visit, right? We clean the body up, put a clean gown, took all their lines out, left the IV catheter in, put the head of the bed up a little bit, clean the body. And now we're ready to transport them to the morgue. Family's been there. We give the family as much time as they want with the body. It's time to transfer them to the morgue. So the student nurse says, should I take the gown off? So how should you respond to that? Leave the hospital gown on. It can't be reused now. Yes, remove the gown and place the body in the shroud. We will remove the gown after we arrive at the morgue. Remove the gown. We will wrap the body in a sheet. You take the gown off and you place the undressed body in the body bag. The reason I use the word shroud is because that is a synonym for body bag. Okay, we don't wrap them in a sheet. We place them in a plastic body bag, also known as a shroud. Okay, so that's what you would need to do. Take the gown off. Okay, well, that's it. Not super complicated. I hope that was helpful to you. It really is important for you to know this stuff. I don't know about you. I don't do a lot of postmortem care because I like to keep my patients alive. So that's why it's hard for me to remember postmortem care. But I'll tell you what, sometimes the more experience we have, the worse we do on NCLEX style questions because I start answering questions based on my experience rather than based on general principles. You always answer NCLEX question based on general principles, not specific circumstances. You only evaluate the question based on what they tell you, not all the other experience that you have with lots of other things. And I think that's where some of you get confused as you start thinking about all the situations you've been in where you did something different. You have to answer NCLEX questions based on general principles, not specific situations that you've been in. Otherwise, who can get these questions right? Because the other people taking the test don't know the specific circumstances you've been in. It can only be answered based on general principles. Okay? All right. Thanks for being part of the Clinic Review family. See you later.